Good day, I'm Hanz Nicole from BSN-3 Block D, and today I will be performing my return demonstration about nasogastric feeding. First, assess the doctor's order for the type and frequency of feeding. Second, assess the client's level of consciousness and their level of knowledge and understanding, because as future nurses, it is our responsibility to ensure that our clients are educated and that they have given us a consent to perform the procedure. Third, assess the availability and functionality of the needed materials. Fourth, assess the client for any clinical signs of malnutrition or dehydration, as this data will help us determine whether the feeding is sufficient for the client or whether they are receiving less fluid than needed. And lastly, assess for any allergies to any food in the feeding. If the client is lactose intolerant, check the tube feeding formula and notify the primary care provider if any incompatibilities exist. Before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of the previous feedings. Then prepare the equipment, a correct type and amount of feeding solution, a 60 ml catheter-tipped syringe, an MSS basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube, or a pre-filled bottle with a drip chamber, tubing, and a flow regulator clamp. Then measuring container from which to pour the feeding if using an open system. Water that is 60 ml unless otherwise specified and must be at room temperature. And lastly, feeding pump as required. Prior to performing the procedure, introduce yourself and verify the client's identity using agency policy, and explain to the client what you are going to do, how you are going to do it, and how he or she can participate. Also inform the client that this feeding is not supposed to, or the client will not have any discomfort, but he or she may still have a feeling of fullness. Good morning, ma'am. I'm Hanz Nicole from BSN-3D, and I will be your student nurse for today. May I know your name, ma'am? And your date of birth? Okay, thank you for that, Miss Kyla. So before we get started, let me just tell you the details of how we're going to proceed with your feeding. So in this container, it contains the formula that you need to replenish the nutrients in your body. And as I pour this formula to your tube, you will not feel any discomfort or pain, but you may still have a feeling of fullness. That's why during this procedure, as well as at least 30 minutes after it, you may just relax and stay seated. So after this, we need to perform hand hygiene and observe other infection control procedures. Provide for client privacy if the client desires it, because tube feedings may be embarrassing for some people. So Miss Kyla, would you like me to close the curtains in your room? Okay. So we can close the curtains and close the door to the room. Before proceeding with the feeding, we must assess the tube placement. So now I have applied clean gloves, and now I'm going to attach a syringe to the open end of the tube and aspirate for stomach content. And we are going to check the pH. some cases, we must allow 1 hour to elapse before checking the pH if the client has received a medication, because some medicines may alter the acidity of the stomach content. And if the client is receiving continuous feeding, we can use a pH meter rather than a pH meter. And we must follow the agency policy if the reading is greater than 6, because this may indicate placement in the respiratory tract. Next, we must assess the residual content. If the tube is placed in the stomach, we must aspirate all the contents and measure it before proceeding with the feeding. However, if the tube is placed in the small intestine, the contents cannot be aspirated. Since the tube of our client is placed in the stomach, I'm going to aspirate the contents now. So the residual content is 5 ml. However, if it is 100 ml or more than half of the last feeding, we must check with the nurse in charge or with our agency policy. And then, we must reinstill the fluid or the stomach content back so that we will not disturb the fluid and electrolyte balance if our primary care provider orders us to do so, or if our agency policy requires. Before administering the feeding, check the expiration date. So it is February 1, 2025. And then warm the solution to room temperature, because an excessively cold feeding may cause abdominal cramps. And since our feeding formula has been here for a while, it is already warm and is ready to use. And then, since we are going to use, I'm going to administer the feeding through an open system using a syringe, we must clean the top of the container with an alcohol to minimize the risk of contaminants entering the feeding syringe. Administer the feeding. Using an open system through the use of a syringe, you must remove the plunger from the syringe and connect it to a pinch or clamp nasogastric tube. Add the formula to the syringe barrel. Clamp the tube and raise or lower to control the flow. And we can also pinch to stop it, since quick administration may cause flatulence, abdominal cramps, or nausea. If we have achieved the desired amount, we must instill in water 50 to 100 ml even before the formula has run through the neck of the syringe. This is to flush the sticky formula and prevent future blockage. And before the water has been instilled all the way from the tube, we must clamp the tubing to prevent excess air, thus preventing abdominal distension. Ensure client's comfort and safety by securing the tubing to the client's gown. Then, ask the client to remain seated in Fowler's position or in a slightly elevated right leg from the stomach to the alimentary tract and also prevent feeding into the respiratory tract and thus preventing aspiration as well. And then, we must remove our gloves.